part where I acknowledge that safe staffing isn't the magic wand. It doesn't fix everything, but what it does is it helps to provide the foundation for addressing almost all of the other issues. Safe staffing doesn't change culture overnight, but what it does is it provides time to staff to kindly challenge and call out incivility and any negative behaviour. It creates time to really ask how each other is and foster culturally positive environments. It facilitates staff to take time to learn from the people that they care for and one another. It provides time to staff to not only listen, but to become curious about their what-ifs. Because it is when we ask the what-ifs that women and people are asked more questions, which sometimes leads to further tests, checks, assessments, referrals and escalation, rather than just dismissing them because their brains are too overloaded to consider the other options. Thinking about the other 7 to 9 patients that they have responsibility for, or the families that they have care for. What safe staffing also does is enables continuity of carer with manageable safe caseloads. Women have said on many reports that they dislike having to repeat their story to multiple professionals. They value continuity from the evidence. Continuity of care has a multitude of positive outcomes, from reducing preterm births, increasing breastfeeding rates and lower postnatal depression, to name just a few. Having standards around caseload size and on-call helps to improve continuity, which also improves outcomes for everyone who enters maternity services. It also doesn't address the medicalisation or the sheer volume of inductions, nor the continuity required to facilitate safe, meaningful care. But what safe staffing does is facilitate antenatal education for all rather than being a postcode lottery across the country. Safe staffing also helps to facilitate the choice of place of birth, where home births and midwife-led centre births will not be shut to prioritise labour wards, because units will be fully staffed up to beyond their establishment to be able to cover all the options and not running on the bare minimum establishment numbers. But continuing this way is not an option across the country. There is so much incredible and amazing work going on in different ways in different maternity units, and we need to have the shared learning across the country of some of the brilliant initiatives which help to improve safety and outcomes for women, people, families, and the trusts which provide honesty and transparency, and they provide the implementation of these frameworks, bundles and models of care, which has been shown to improve outcomes. And what I really hope from this maternity review is that it provides recommendations which are not wishy-washy and open to interpretation, but instead have real, specific, measurable and achievable with the right funding and infrastructure to achieve better outcomes for everyone. Safe staffing is not going to be the magic wand to fix every aspect of maternity care, but what safe staffing does is it provides the foundations to build for a better future maternity service for all.